Alrighty, so I chose the thrombectomy as the presentation procedure. Thrombectomy is a procedure that feeds a catheter through the arteries into the body and into the brain in order to remove the clot to restore blood flow to that part of the brain. It's most effective within 6 hours of having the symptoms. As patient preparation, you'll be asked to sign a surgical consent form along with an anesthesia form. And if you can't do that, whether you're rendered unconscious or not, then you can get your next of kin to sign one for you. Frequently asked questions, they might ask you if you have allergies, any recent health changes, and if you're a woman, may be pregnant, may or may not. And then if you have any issues with anesthesia. And they will also administer any tests according to how they see fit, which is going to be an ultrasound, MRI, CT scan, venogram, and then they're going to do blood tests just to make sure for your overall health. The equipment and the instruments used, so we're going to use aspiration catheters, aspiration pumps, microcatheters, guide wires, and stent retrieval tools. And basically, aspiration catheters, it's like a small vacuum that sucks out the clot, or the thrombus as you want to call it, and it gets that out to restore blood flow. The aspiration pump actually applies the pressure inside the arteries to then allow for this vacuum to pull it all out. Microcatheters and guide wires are just to get all of those things, the vacuum, the stent, we're about to talk about in a second, all the way into the arteries to then be able to pull all that stuff out. And then the stent retrieval tool, so once the stent is in there, it's like a little mesh, and it holds the artery open like this. And then that's where the aspiration catheters goes in and be able to suck out the thrombus, and then the stent is either left in there depending on how structurally sound the artery wall is, and if the artery is structurally sound, then they can actually collapse the stent and remove it with that. So the medications administered during the thrombectomy is going to be, so there's going to be an IV drip for hydration. There's also going to be blood thinners, and then there's going to be heparin. So the blood thinners and heparin are to help thin the blood so there's not any more clots going on, and then there also is going to be, the anesthesia is going to be given through the IV to make sure that you can sleep and then there's not a lot of pain throughout the procedure. Risk complications, excess bleeding can be severe enough to cause death. So when he goes in, so depending on whether it was a stroke or just a normal thrombus like in the leg, so you have a clot that's stuck in your calf, they'll go and cut above it, and then it could lead to some internal bleeding. You have a serious infection because you are indeed cutting open the body. You can do damage to blood vessels and stuff like that, very finicky stuff. Reaction anesthesia, pulmonary embolism, and other chronic conditions that could be found later that you and the doctor did not know about previously. So they're going to administer the IV to the patients, give them anesthesia. They're going to remove the hair from the surface and or depending on where the actual thrombus is inside the body. And then they're going to give local anesthesia to numb the area. They're going to, if it's not in the brain, they're going to cut open along the top of the artery. They're going to open it. And then to help the doctor see, in some cases, they're going to give you have an angiogram running the whole time, which is going to be, think of like a stop motion camera. The angiogram gives really fast repetition of x-rays so you can see inside the artery in which you're performing it under. And then they're going to remove the clot, and then they are going to surgically repair the blood vessel and then repair the incision on your skin. And if it's the clot that has traveled to your brain, they're going to run a catheter either through your wrist, is what they've been liking to do recently. They're going to run it through your wrist here, and they're going to feed the catheter up your arm, up the superior vena cava, and into your brain. And they're going to use a balloon on a tiny tube, which is the catheter, and it's going to deploy the stent, which is on the outside of the balloon. So when they inflate the balloon, the stent grows, holds the artery open. They're going to attach the aspiration catheter. They're going to suck out the thrombus, and then depending on the level of healthiness of the blood vessel, they're going to remove or keep the stent in there. And then the surgeon will resupply blood flow, and then they'll close you back up. So post-procedure, you'll spend a couple hours in intensive care just to make sure, because with stuff like that, they're going to try and narrow your medication down to an exact science to make sure that you'll be able to go home and not gonna have any random instances of health crisis or anything like that. So they're gonna have a team that's gonna come check on you, take your vitals every now and again, and then you'll be in the hospital for 2 to 4 days, probably something like that. Recovery process: they're gonna give you medications to stop future clots from happening, and then you're gonna be in touch with probably a cardiologist for clots and stuff like that. They're gonna let you know anything. They're gonna adjust your medications to let you know like that and stuff like that. So you're gonna have to keep in touch with them just in case anything does happen, and they'll help you go through the whole process, make sure another stroke and or ischemic problem doesn't happen. And they're gonna ask you to get up and move around just to get the blood flowing, because if it does pool, it likes to coagulate, and then that's what causes a clot. Is the platelets inside the blood cell like to grab onto each other and then form this hard, which you can call a scab. It's just a scab inside of a blood vessel. So when you go home, your healthcare provider will keep in touch with you, and then your significant other and or another provider would help you come and check, and then they'll come bring you back to in the hospital for any angiograms, CT scans, or venograms, if anything like that, if you need to get a recheck up. So why I chose to do a thrombectomy is this is my dad. He's the one. Beautiful man to the right. In late September, early October, he actually had a stroke, and he was rushed to the hospital, and he had an immediate thrombectomy. They did all the consent forms. My mom was there and everything. I was at school, unfortunately. I was laying in bed at 11 o'clock at night, probably on like a Tuesday, watching TV, getting ready to go to bed, and my brother calls me, and I don't call my brother. We don't talk a whole lot, and he just calls me and was like, "Hey, Dad had a stroke," and I was like, "All right, stop messing with me." And he was like, "No, I'm not." So I drove home the next day, and I went and stayed with them. Thank God he's all right. He's getting the help he needs. He is out of the hospital and back home, and he is doing great. He's got limited motor function on his left side, but other than that, like, he's gonna be fine. He'll make a full recovery, and without the help of surgeons and my mom and the procedure itself, again, like I said in the presentation, I don't want to think about what my life would be like or where I would be if they hadn't done what they did, or my mom hadn't done what they did, or the doctors didn't know what to do. So with this procedure, I am forever in its debt. And then here's a couple words that I was saying inside in this presentation that some of you might not know. So an angiogram is an X-ray that does the quick little stop motions to examine blood vessels. A venogram is a test that lets your healthcare provider know to see the veins inside your body, especially in your legs. So if you have a thrombus in the calf, which then if would release can go to your heart and cause major issues, and we don't want that. CT scan, another X-ray machine, MRI, one of those, just look at all the structures inside of your body on like an imaging picture so they can get a good idea of what's going on. Ultrasound, most people know what an ultrasound is for when pregnancy and stuff like that, but they can use sound waves to like look inside your body. And then aspiration is the drawing and sucking motion of like basically, so like a vacuum is an aspirator per se. And then here's the reference slide. Thank you.